We're Air Ambulance Charity, Kent, Surrey, Sussex, your local air ambulance charity. We hope you never need us, but every year lots of people in our local area do. Serious emergencies can happen to anyone, anywhere. On the road, on the beach, even at your school. When the phone rings, we can get to anyone in under 30 minutes. We have 3 helicopters and 4 cars, all fitted with life-saving equipment and medicine to help save lives. We have 2 medical teams deployed at any one time. We can get to you fast. We bring expert doctors and paramedics on board, and we carry life-saving equipment straight to the scene. Our helicopters are like flying emergency rooms, just like you might see in a hospital. We have lots of advanced equipment, and our doctors and paramedics work very closely with land ambulances to make a bigger team of people helping to treat the patient. Each helicopter has a life-saving crew made up of 2 pilots, 1 paramedic and 1 doctor. When someone calls 999, we have a team of people who look at these calls called dispatchers, and they will decide if the air ambulance charity is needed. We only get called out to very serious emergencies. Our doctors are highly trained in giving emergency medicine and anaesthesia, and they can make a diagnosis to decide what's best when they're with the patient. Our paramedics are highly skilled and have at least 3 years' experience working in the ambulance service before they can work with us. Our pilots make sure we arrive at the scene as quickly and as safely as possible. They support the team and are very skilled in landing the helicopter in all areas.
Good evening, everyone. Thank you for joining us as part of Restart Heart Day or Restart Heart Week here at Air Ambulance Charity Kent, Surrey, Sussex. Today's been awesome. Today we've been aiming to teach as many people as possible how to save a life. My name's Ben. I'm one of the paramedics here at the charity, and I'm joined by...
I'm Lindsay. I'm also one of the paramedics at the charity.
So far throughout the day, we've run 4 or 5 sessions aiming to train as many people as possible how to be lifesavers. And hopefully we're joined by children who have been at school today, who have learned how to be little lifesavers, and they're coming home to kind of train their parents. Or we've just got adults joining, or anyone joining who couldn't join us throughout the day. In terms of what you need, Lindsay's got a mannequin with her, I've got a teddy, but even if you don't have either of those, you can use a cushion, a pillow, a rolled up blanket, anything. And we're going to show you a load of things, aren't we, Lindsay?
Yeah, we are.
What are we going to show them?
We are firstly going to show them how to check for danger and also whether someone's responsive or not.
Yeah, awesome. And then from there, we're going to go over to Carol, aren't we, to talk about how to call 999 and the process of kind of dispatch around our aircraft. And then after that?
Then we're going to talk to one of our pilots who's going to tell us all about the helicopters.
Yeah, and then finally, I guess we're going to get everyone out there to do some work, aren't we? We're going to show you how to do CPR and also how to use a defibrillator. Some really important skills to know how to do, and they can really make the difference, can't they?
Yeah.
When people suffer a cardiac arrest. So throughout the day, we've run the sessions with 3 rules, haven't we? 3 simple rules to make sure everything stays on track. Do you want to talk us through the rules?
Rule number 1, keep your eyes peeled for danger.
Check for dangers. Rule number 2.
When we're saving lives, it's okay to use our outside loud voices, so you can shout as loud as you can. So when we're asking you questions, I want you to shout as loud as you can so we can hear you.
Yeah, definitely. And rule number 3, probably the most important rule for us today, isn't it? What's rule number 3?
So the best lifesavers, like us, and you will teach other people how to save lives. So I want you to spread the word about how important it is to know how to do CPR, and I want you to show people how to do it. And if you can't remember, then just check out our website, which will show you videos, and then you can show other people.
Yeah, definitely. So the first thing we're going to do is we're going to play you a little video, and that's showing Paul, who's one of our patients, and he survived his cardiac arrest because of lifesavers like you out there.
Hi, my name's Paul Maycock. My wife had gone up to her mother's, and I decided that as it was a nice afternoon, I'd put my gear on and go out for a bike ride. I was on my way back when I had my cardiac arrest, came off the bike, hit my head on the road. I had a helmet on naturally, which obviously helped to save my life I was fortunate enough to have people following me who recognised exactly what had happened and started to perform CPR on me.
So when the call came in, the initial information that we were given was this was a cyclist who had been found unconscious. Once we got to scene, we understood that Paul had a heartbeat back after being shocked with a defibrillator a number of times. We took Paul up the road to the helicopter and then we flew him to London, which was the closest appropriate centre.
Paul is a clear example of all elements of the chain of survival in action. His recovery is testament to the bystander that stopped and performed CPR before the ambulance arrived, and then the great care that the ambulance service were able to deliver alongside the critical care paramedic. There's 4 steps to the chain of survival: early recognition, early CPR, early defibrillation, and post-resuscitation care. The first 3 of those 4 steps can be provided by you yourself, and therefore over the next 20 minutes, you're going to join us in learning how to provide these steps and this care. Battling a giraffe. Right, so welcome back everyone. We are going to now talk you through the chain of survival, a bit like what Paul kind of alluded to and what we talked about in that video there. So we're going to use kind of an approach, aren't we, to talk through this. So we're going to use doctors A, B, C, okay, as seen up there. And the first bit, Lindsay, what does the D in doctors A, B, C stand for?
Danger.
Danger. Danger, yeah. So, and that's also rule number 1 for us, isn't it?
Yeah.
Yeah, awesome. So what we want to see out there, stick in the chat if you can, anything that you guys think might be a danger, because actually as clinicians, we're well used to looking for dangers.
Yeah.
We don't miss dangers. We are kind of well drilled in keeping an eye out for it.
No.
We've had loads of good ones today.
Snake.
Yeah, so I guess snake's an issue. So we've got things like people have talked about fast roads, we've talked about water, we've talked about
And
chemicals. Snakes, lots of people have talked about snakes today actually.
Yeah, good.
The
Snake.
school children talked about snakes earlier, the session earlier talked about snakes and stuff. But the big things that we normally see are things like fast roads, like nearby water. It can be like a really just adverse environment, whether that be like really heavy rain, whether it be freezing cold. What we don't want is for you guys as a rescuer, you said snake, I'm trying to talk through the rest of it. For you guys as rescuers to need rescuing as well, okay? So I take your point about a snake, but it's quite a rare thing.
You're just not listening.
I'm listening. I've kept my eyes peeled. We've talked about snakes, but we need to talk about the big issues, the things that people are going to frequently see, Lindsay. All right. So after checking for danger, the next thing we need to do is check for a response. Anyway, Lindsay. So it could just be that your colleague is asleep, but actually we need to wake them up.
I just wrestled a snake. I was tired.
And not everyone's going to have a giraffe with them to wake them up. So Lindsay, how do we get a response?
Not by hitting them with a giraffe, that's
Not
for
by
sure.
hitting with a giraffe.
Shake and shout.
Shake and shout, exactly.
Hello, can you hear me?
So exactly that. We want you to shake them firmly on the shoulders, don't we? Yeah, and give them a nice big shout, because it might be that the person's sleeping. Yeah. Okay, and actually, if your patient wakes up at this point,
That's all good.
it's all good. So we've checked for danger, we've checked for response, okay? But the next thing is that actually, if the person doesn't wake up, as little lifesavers out there, it's really important we know how to get help quickly, isn't it? So who are we going to call?
Ghostbusters?
Not Ghostbusters.
Oh.
This is potentially lost on the audience as well.
999.
We're going to call 999. So we are going to hand you over now to Carol, who's one of our dispatchers, who dispatches our aircraft to some of the most serious jobs that occur in the southeast of England every single day. Okay, she's going to give you a couple of tips and tricks about how to call 999, how for us to get help to you fast, and how to make it easier for our call handlers in the control room.
Hello, my name's Carol. I am a dispatcher for the Air Ambulance Kent, Surrey and Sussex. Today, as a little lifesaver, I'm going to tell you how you can call and stay calm in an emergency. So firstly, you need to speak clearly. If possible, call from a landline. If you don't know your address, who can you go to? So we're going to pause for 10 seconds. Okay, so you can either go to a neighbour, you can go to your teacher, or you can shout for help. So once you know your address, what are the first two questions the call taker will ask you? So they will ask, is the patient conscious and is the patient breathing? Okay, the call taker will then tell you how to do CPR and when to open the door. Once you've opened the door, you go straight back to the person. Afterwards, you don't stop the CPR until the ambulance crew arrive and take over from you. So also you need to think of the risks. Is there a second person available? Can they wave the ambulance crew down? So just a short recap. You will be asked, is the patient conscious and is the patient breathing? You need to know your address and who you can ask for help if you don't know your address. Open the door when you are told to. Have someone meet and wave down the ambulance crew. And if you can, put away any family pets.
Lovely. So welcome back. So Carol's given us a couple of tips around calling 999, which can be a really stressful call, can't it? And actually we know that those who are calm and confident and have made plans before and essentially rehearsed this, they tend to do best, don't they? Lindsay, do you want to talk us through some of your favourite tips that Carol gave us?
Yeah, I think one of the most important things is knowing your location. So whether you're out and about, or whether you've gone for a walk, looking for the nearest road sign at the junction, and knowing your home address are really important things that while we're sat here in this nice controlled environment, we think, of course we'd remember that. But when you're a bit panicked because you've had to call 999 because someone's not well, those sorts of things go out of your head. So just being really sure that you know where you are. Having 3 words on your phone is another thing that's really good.
And what about neighbours, Lindsay? How can they be really helpful in this situation?
Just by calling them. So opening the door, shouting out nice and loud, going and finding someone, knocking on the door, asking them for help.
Yeah, definitely. And kind of young children, you know, who may not be able to make all that call on their own. I guess it's establishing that plan, isn't it? Of,
yeah.
You know, having someone that you could go to next door, have someone nominated so that if, you know, as a really young child having to make a call, they know where they could go to get some help. So now that they've called 999, Carol could be dispatching our helicopter to help deliver our doctors and paramedics to come deliver life-saving care. So what we're going to do now is we're going to hand you over to Suji, who's one of our pilots, and he's going to show you essentially around the aircraft and show you some of the capability that allows us to get to anywhere in the southeast as quickly as possible.
Hello everyone, I'm Suji, I'm one of the pilots here at KSS, and I'm here to tell you a little bit of information about the helicopter that you can see behind me. It's an Augusta Western 169. It's a very fast, very sleek helicopter, and it allows us to get to everywhere that we cover in Kent, Surrey and Sussex within 30 minutes. We travel at about 170 miles per hour, which is very fast. It's a lot faster than your parents' car, and it allows us to get our doctor and our paramedic to our patient as fast as possible, which gives them the best chance in whatever situation that they have happened to get themselves into. So this is the inside of our aircraft. The Augusta Western 169 has a large cabin space which allows us to take both our doctor, paramedic, our patient who's critically injured, and potentially a parent with us to hospital. We have this very large stretcher that the patient will be arriving from the scene with our doctor and paramedic. They slide in over the top of here. They then get hooked up onto a ventilator and a monitor system, as you can see in the background. We then push this in, rotate it in, and slide the passenger into the centre of the aircraft with all the straps on. We get our doctor and our paramedic on board, and then we take off and take them to hospital as fast as we possibly can. As you can see, it may look relatively small from the outside, but it is one of the largest ones that is around in the air ambulance industry, and it works very well for us. It's a heavy helicopter, but we are able to still travel at that 170 miles an hour. It nearly weighs the same as a bus, so it's quite interesting going from point to point with such a large helicopter. When we are on a call, we use an alpha call sign instead of blue lights, because that gives us priority with air traffic control so that we can go from one place to another as fast as possible. That then allows us to get to the patient and deliver our crew to them as soon as we can. Once we finish that, we are able to potentially go on to a second job with the amount of fuel that we carry, up to 2 hours worth of fuel. So once we've done that, and then we have to go back to base and then refuel and then hopefully wait for another task to go and help somebody else.
Okay, lovely. So let's recap what we've learned so far, Lindsay. So what's the first thing that we taught people?
Check for danger. Make sure there's no snakes.
No snakes. No snakes today. No issues at all. We're safe to approach. What's the next thing that we need them to do?
Check for a response. Hello, can you hear me? Wake up.
And if we've got no response, what's the third thing that we've kind of shown them through and want them to do?
To call for help and call for 999.
Yeah, and we've spoke to Carol, who's kind of talked us through that. And then finally we spoke to Suji, didn't we? We've just seen him, one of our pilots, who showed us about our helicopter and how his skills and his colleagues' skills allow us to get to patients really fast. But now we need everyone out there's help, really. We know that if someone's heart isn't beating properly, we need them to help the patient before the ambulance or our teams arrive. So Lindsay, remind us of the 2 questions that Carol told us about in her video. She said the 999 call handler would ask what?
Is the person awake?
Yep.
And are they breathing?
Perfect. So we've already shown them how to tell if someone's awake, haven't we? And that was for our shake and shout. Yeah. But actually, we now need to talk about breathing, because breathing's really difficult, isn't it? How do we tell if someone's breathing normally? How do we do that?
Well, you and me are breathing normally, and I'm sure you all are at home. So look at each other. Can't really see that you're breathing, but I know you are because you're talking to me. So it's really important that we check for breathing by having the airway open, by tilting the head back, and look, listen and feel down the chest. So feel for someone's breath on your face, listen for the breathing, and look down their chest to see if you can see any movement, any steady rise and fall.
So if they're not breathing,
That's bad.
I guess that's really easy to tell. What about long pauses in between breaths?
That's also bad.
Okay, so what about if they're snoring? Yeah,
Really bad.
just like that, I guess.
Yeah.
Does sound bad. And what about agonal breathing? We've talked about agonal breathing quite a lot today with people. So what is agonal breathing?
Agonal breathing, the best way I can describe agonal breathing is it kind of looks like a goldfish. So take a goldfish out of water, not recommended, and its mouth goes like this. And as you can see, that is not normal.
And that's really tricky, isn't it? Because we know that lots of people mistake agonal breathing for actual breathing. So it is really that kind of fish out of water, air not really moving, is it? It's just them kind of gasping, okay? Because if the breathing's not normal, any of those kind of things that we've talked about, we're going to start CPR, okay? And this is where every single one of you out there is absolutely key, okay? So we want you to practice this with your teddies next to you, with your cushions, your pillows, your rolled up hoodies, whatever you've got. We want you to practice your... What are you doing? What are you doing? God.
Mouth to mouth, right?
Mouth to mouth. No. You don't need to worry about that, Lindsay. You can put all of that away, because we're not going to do any mouth today.
We are?
No, we don't need to. All we're going to do is compression-only CPR. So actually, that's what's recommended now.
Okay.
So we have lots of people worried about needing to do mouth-to-mouth, but we know that if we ask people to do mouth-to-mouth, they're less likely to do CPR.
That is true, actually.
It's true. So what we want you to do is we're just going to do CPR. So you're going to put your hands on top of each other. Okay, you can interlock your fingers, you can hold onto your wrist, you can do essentially whatever you want. But what you need to do, and most people do interlock their fingers, is you're going to have nice straight arms, you're going to kneel next to your teddy, your mannequin, your cushion, your pillow, okay, and you're going to put the heel of your hand in the centre of the person's chest. So you're going to draw an imaginary line from armpit to armpit, and you're going to put the heel of your hand in the centre of the chest. Okay, and then what you're going to do is push down 2 times a second. Okay. Now, kind of our little lifesavers out there, the children who are doing CPR, so that's children who are doing CPR, you're going to push as hard as you can, okay? For grown-ups, you're going to push about 5 to 6 centimetres, okay? And exactly as Lindsay was doing, about twice a second. Lindsay, what's the issue if we go too fast?
Well, let me demonstrate for you. Here's my little heart. And as we push down on the chest, we squeeze blood out of the heart, around the body to get up to the brain. And then as we bring our hands back up, we draw blood back in to push back out again. If we go too fast, we're not going to give the heart a chance to fill back up again. So therefore, it's not very effective CPR, which is why we push down, up, down. So good quality chest compressions.
Awesome. So Lindsay, whilst you're doing that, I guess we're going to carry on doing this until help arrives, but there are some occasions when people can stop doing CPR, isn't there?
Absolutely.
Do you want to talk us through them?
So firstly, if the patient wakes up, so if they start to show signs of life, so if they start making purposeful movement, or if they tell you to get off, they clearly don't need CPR anymore.
Awesome.
Secondly, so when the emergency services arrive, so when we turn up or when the ambulance service turns up, they may say to you, you're doing a really good job, please can you carry on while we get our equipment ready? And then once they're ready to take over, they'll just move you out of the way. And then the last time, which I'm starting to feel now, I don't know about you, is when you are too physically tired to carry on. So that's why the emphasis early on is about shouting for help and getting someone else to help you, because if you're doing chest compressions for a long time, you will get tired.
Yeah, definitely. So chest compressions is kind of half of the puzzle, isn't it? We've talked about this today. So chest compressions allows us, exactly as you say, to compress the heart, move blood around the body, and it essentially buys us time, doesn't it?
Yeah.
But what we also need is a defibrillator, don't we? So we use a defibrillator to try and restart the heart and get it into a rhythm beating on its own. That's exactly what we're going to show them now.
Great.
So we'll ditch the telly for a second.
Okay. Now limber up.
And we'll use our defibrillator. And what we want you to do is kind of practice along at home, kind of copy what Lindsay's doing as you're doing the CPR to get extra practice, and we'll show how the defibrillator kind of fits within it. Okay?
So I'm going to count out while I'm doing my chest compressions. 1, 2, 3.
So Lindsay's
4.
doing her CPR, and we're going to turn on the defibrillator, pressing the green button, and we're just going to follow the instructions.
Emergency medical services now.
So exactly as we've talked about, we're going to call 999, ask for an ambulance, and tell them what's happening, okay?
Remove all clothing from chest and stomach.
So remove the patient's clothing in order for you to access the chest, and these kits will have scissors with them for you to be able to cut through. You're going to pull the pack out,
Open the pad packaging.
you're going to tear it open, and you're going to find 2 pads, okay? I'm going to come show you these up on the screen.
Picture on each pad.
Alright, so you can see these pads on the screen,
And
One.
stick to the bare skin of the patient.
and I'm trying to work out it's
exactly
backwards,
as shown
and number
in the
2.
picture.
Alright,
Peel off the pad labelled 2.
we're going to peel off the pads, and we're going to stick them exactly where the pictures say.
The picture.
So pad number 1,
Press the pad firmly to the bare skin of the patient.
pad number 2. Okay, as soon as the pads are on,
Analysing heart.
the machine recognises it, okay, and it wants to start analysing.
Advise.
So exactly as Lindsay's doing, we're going to stop touching the patient and make sure we're nice and clear.
Press the orange button.
We're going to press the flashing button
Shock
to deliver a shock, and then we're going to go straight back on the chest to deliver CPR.
CPR now.
It's absolutely
Press the
as simple as that.
I button for CPR. System shutting down.
So Lindsay, these machines are really cool, aren't they? They won't let you shock anyone with a pulse,
Nope.
and they're designed for kind of anyone who's had no training to use, aren't they?
Absolutely, they're simple.
Yeah, just got to follow the instructions.
Yeah.
So what we're going to do is we're going to pull all this together now. So what we've shown you, we're going to walk you through the doctor's ABC from start to finish, and we'll show you exactly how simple it is. Okay. You ready?
Born ready.
Born ready. Wow. Okay, Lindsay, this lady
Yes.
has been walking down the road,
Kylie.
and she's collapsed. Okay. What do we need to do? What's the very first thing we do?
Check for danger.
Okay, so we check for danger,
Safe.
and it's safe. Okay. What's next?
Hello, can you hear me? Wake up.
Exactly that. So we're going to check
Responding.
for response. Okay, we're in our shake and shout.
Help.
You've called for some help, and we're also going to try and call 999 as well. What's next?
Okay, airway.
Going to tilt it back. We're going to look, listen, and feel, and we're checking for breathing. Okay. Remember those 2 questions that we said Carol would ask: Are they awake? Are they breathing? So this person's not breathing at all, Lindsay. So exactly as Lindsay's doing, she's going to start CPR straight away. So hands together, centre of the chest, 2 times a second with nice straight arms. We've got a defibrillator, so we're going to use that as soon as we can. So we're going to turn it on, and we're just going to follow the instructions, okay? What you'll notice is that Lindsay doesn't stop the CPR for us to use the defibrillator, okay? We just carry on around.
Follow the voice prompt calmly.
So we're going to follow the instructions. It may feel a little slow, but we're just going to do exactly what they say. So take the clothing off so you can access the chest.
Take out the pads from the bottom of the device.
Take out the pads.
Tear open the pad packaging.
Open up the pads. We're going to stick number 1.
Closely match the picture on each pad.
We're going to stick number 1 on the top of the chest.
Peel off the pad labelled 1 and stick to the bare skin of the patient, exactly as shown in the picture.
We take pad number 2.
Peel off the pad labelled 2
Stick it on
to the bare skin
up right underneath the left armpit.
exactly as
Okay.
shown in the picture.
As soon as they're on, the machine will start to analyse.
Press
Okay.
pads firmly,
And what we'll hear is it start to say, "Don't touch."
analysing.
Lindsay's going to take her hands off so she's not touching.
Stop.
We'll let it analyse. It wants to give a shock.
Stand
So
clear.
it's now nice and clear.
Flashing
Press the button,
delivered.
and then Lindsay's going to start her CPR straight away afterwards. Okay?
In CPR.
You're going to carry this on until essentially either of those 3 things that we talked about earlier happen. So the person wakes up, the emergency services arrive, or whether you're too tired to do anything else.
System shutting down.
The machine will give you instructions and it will just reanalyse every 2 minutes right now.
Yep. Super simple.
It's as simple as that. So there is nothing more to it in terms of what there is to CPR and defibrillation. What we're going to do now, we're going to pass you over to a video of Duncan, who's one of our senior doctors here at the charity, and he's going to talk a little bit around what the future holds for us as a charity and some of the really kind of innovative things that we can do in cardiac arrest care, as long as kind of lifesavers out there like yourselves kind of lay this really good foundation around early CPR and early use of a defibrillator. I'm going to pass you over to Duncan, and then if you've got any questions, if you stick them in the chats, we'll wrap those questions up when you come back to us afterwards.
So thank you everyone for joining us this afternoon and essentially training to become little lifesavers with us at KSS. Now, for our final session, we're joined by Duncan, one of our doctors here at the charity, and we're going to explore a little bit around what happens now that you're little lifesavers for us, what care we can do on the basis of you helping us. So Duncan, the first question, I guess, is the really simple one. It's we're asking as many people as possible to learn CPR, but some people would say trying to teach these little lifesavers that we've got in front of us, they're too young. Do you think that's the case?
Absolutely not. So the most important bit about helping people to survive after cardiac arrest is early CPR and early defibrillation, and anyone can do that. It doesn't matter whether you're 7 or you're 70. Everyone can play a part in saving a life.
Yeah, I couldn't agree more. And we saw this last year, didn't we? When we did the training, we saw thousands of children get involved. Now, in terms of what we're doing as a charity and building upon the work that they're going to hopefully do to help support us, we're in the early phases of exploring something called ECMO. Now, we all know this is quite a complex thing, but could you try and explain that for the children and what that would mean?
Yeah, so ECMO is a technology, is a machine that works to support or to replace the heart as a pump. And the machines now are small enough that we can take them on the helicopter with us. And so we're looking at and exploring, can we take that machine with our crew to the patients to try and really increase the number of people who survive from cardiac arrest?
And this could be absolutely transformational for us, couldn't it? We could save even more lives.
Yeah, so it's a really exciting technology. It comes with an awful lot of work for us to think about how we might make this work for the communities that we serve. But certainly there seems to be potential that we might be able to save even more lives with it. So yes, very, very exciting.
And the final things, the little lifesavers, they've been learning about the chain of survival. And we've talked about the third step on that, early defibrillation. And we're starting to explore the use of drones, aren't we? How are we doing that, and how does that link to the chain of survival?
So like we were talking about, the most important piece in helping people survive from cardiac arrest is early CPR and early defibrillation. And We know that most people who have their cardiac arrest have it in their own homes or in public places, and so they're often not close to a defibrillator. And what we're doing is we're looking at ways that we might be able to get a defibrillator to those patients, to the public, as quickly as we can, even more quickly than if we were to take it by the helicopter. One route that we might do that is through the use of drones. Again, it's complex in how you actually make that work, but we're looking at all the ways that we can do to try and get the defibrillators to the patients.
It's awesome. I think there's some really exciting work for people who have a cardiac arrest in the southeast, and with our work and our communities, where I think we will save even more lives. I think the last thing to say is just a thank you for joining us today. We're going to leave you with our next steps, and if you want to be involved with our charity and support us in the future, there'll be some links for you to follow.
Lovely. Welcome back, everyone. Thank you for giving us a little bit of your evening tonight, just to be able to train you and hopefully show you some really important life-saving skills. We've got a couple of questions that we're going to rattle through really quickly. We've got a couple of questions that we've been asked throughout the day that have kind of cropped up on our social media and stuff. We're going to put those out over the next couple of days as well. But question number one was, how long do I wait after the shock to start CPR? It's a really good question, isn't it?
It is a good question, because a lot of people are worried about the defibrillator giving them a shock. So as we demonstrated, as long as no one is touching the patient when the shock is delivered, that's all good. And then as soon as the shock button is pressed and the shock is delivered, it's safe to touch the patient. So straight back doing those chest compressions again.
Yeah, definitely. We've had, if the technique isn't quite right for CPR, could that cause more harm than good?
So no, because any chest compression is better than no chest compression, and even a bad chest compression is better than no chest compression. So essentially, as long as you remember that the heel of your hand goes in the center of the patient's chest and you push down twice per second, it's all good. But like we said, any chest compression is better than no chest compression.
Definitely. And that's the point of today, isn't it? It's not about people out there being experts all of a sudden. It's about people having the confidence to do it, because you're always going to have a call handler telling you what to do, offering you help and advice. So you've not got to be an expert. You've just got to have the confidence to start. And that's the biggest barrier, isn't it? We know that. Someone's put, what's the youngest age that could attempt to perform CPR?
Oh, so I think that's another good question, but it is tricky, because in reality, someone that's small enough, a child that's small enough to not be able to physically carry out CPR probably won't be on their own in that situation and able to comprehend what's going on. So however small they are, if they understand what's going on and they've done their doctor's ABC, just have a go. And hopefully they'll have shouted for a grown-up. So like we said, anything's better than nothing. Have a go, make sure that someone's there to help them, and hopefully if the child is too young to be able to physically do the chest compressions, there won't be an adult far away.
Yeah, and we know from our training, don't we, when we've trained children to use the defibrillator, we've trained children down as young as kind of 4 years old, haven't we? They're really good at kind of just following the instructions on the defibrillator. So like you say, the strength's a bit of an issue, isn't it? But something's better than nothing, and they can definitely still use the defibrillator, can't they? Down at kind of 3 or 4 years old. What else have we got? We've got, should you check their pulse as well? We've had a couple of questions today around pulse checks, haven't we?
Yeah, we don't do pulse checks anymore. It's really unreliable way to assess whether the patient needs CPR, which is why we emphasise doing your breathing check, and your indicator for starting CPR is, are they breathing? Yes or no. Is that breathing normal? Yes or no. If the answer is no to both of those, then you start CPR.
Yeah. Perfect. So that probably wraps us up for kind of the end of today. If you tag us in any questions you've kind of got, we can always pick them up in social media over the next couple of days. But I guess just to kind of bring everything together, we've talked about it. We're your local air ambulance charity. We are a charity and work pretty much off kind of donations from members of the public. That's the bulk of how we run our operation. So there's many ways to support us. Being here today as Lifesavers is a massive way of supporting us as a charity. But if anyone's inspired to do anything more to support us, you're more than welcome to go to our website. There's many ways to get involved, you know, and there's lots of information on there. And actually on the slides, just as we close the screen in a second, you'll see a couple of links to stuff if anybody wants to come and learn more about our charity or support us. Otherwise, thank you very much for joining us.
Thank you.
Yeah, thank you.